Succes i veterinær praksis, podcast nummer 155. Velkommen til, dyrlæge Søren Pejstrup her. Hvis du er ny her i podcasten, så husk lige også at kigge over på hjemmesiden. Der er rigtig meget god faglig viden, du kan få med dig derfra. I dag der skal vi snakke om et af mine yndlingsemner, om ortopædi. Og så ved jeg, at der er nogen, der måske nok ligesom bliver sådan lidt grå i ansigtet over den her slags. Men ideen med dagens podcast er jo faktisk netop at prøve at gøre det her nemmere for dig. Jeg er så utrolig glad og stolt over, at jeg har fået Ole Frykman med i podcasten. Dem af jer, der har mødt ham og har set hans undervisning, ved, hvor fantastisk dygtig han er, både til at formidle, men også hvor dygtig han er som dyrlæge. Og derfor er jeg rigtig taknemmelig for, at han har lyst til at bruge lidt tid sammen med os i dag. Vi skal snakke om et system, der hedder COAST, og det er en måde at evaluere artrosepatienter på en systematiseret måde, sådan at hvis ikke du står med mange af de her patienter, at du på en eller anden måde kan være sikker på, at du når alt det relevante rundt alligevel. Også selvom at ortopædisk undersøgelse måske godt kan synes at være lidt udfordrende. Ole nævner også sin hjemmeside, og jeg skal nok sørge for, at der er link til den over på noterne til den her artikel. Du finder links og noter til dagens afsnit som sædvanligt over på hjemmesiden på SIVP.dk/155, og så over til interviewet med Ole. So the scene is in Severin in Middelfart, and Ole, you agreed to stop on your way past here to talk to me for a short time on a project you have been involved in. It's I know when we're talking about scientific papers and scientific work, it shouldn't, in theory, matter who made it, because it should live up to certain standards, right? Yeah. But we are only humans, and I have noticed that you and some of the other very big players in our field have been involved in this project. So it's a very it's a very heavy piece of work, and I'm very glad that you're willing to take the time to talk to me. But before we dive in, what is important that people know about you before we start?
Well, my name is Ole Frykman from Sweden. Well, I've been working as a veterinary ortopedic surgeon for almost 40 years now. I've been in different animal hospitals in Sweden and also in Strömsholm, which is the biggest hospital in Sweden for the moment. And a couple of years I also was a teacher in the faculty in Uppsala. Mm-hmm. And since about 12 years I am working as a consultant and traveling around to different hospitals and clinics just to supervise and to educate in surgery, both orthopedic surgery and soft tissue surgery. Yeah.
I've attended some of your lectures as well, and you do some teaching as well, and palpation courses and other stuff here in Denmark. So a lot of people will know who you are anyways, here in Denmark anyways. But so this COAST thing, I would imagine that some people haven't even heard of it before, and some might have seen some of the materials that was sent out from Elanco, one of the firms behind this. Yeah. So can you, maybe you should start by giving us a broad overview. What is this COAST thing? Yeah.
Well, the name COAST is Canine Osteoarthritis Staging Tool. So it's a tool to make life easier for us vets to diagnose, to understand what osteoarthritis is and how to improve our treatment. So this is, so to say, the first step taking care of this patient that we will see in our practice. And the idea for COAST was originally come up from Elanco, the Elanco US. Mm-hmm. And there have been a lot of discussions on the subject to understand osteoarthritis. Because this is, as you know, this is everyday work for us. Mm-hmm. And we are not going to dig into the scientific stuff because it's huge. But one thing to say that I think is very remarkable is that in a very, very big global investigation many years ago now, but even it's still accurate, you can show that about 20% of dogs over 1 year of age have some sort of detectable osteoarthritis sign or changes. And why it is so, that's a complete other thing to discuss, because that will take the whole evening.
Yes.
But also, this was the initiative from Lankan to understand why is this the case? Why is it like this? And how can we approach this problem? How can we, in a simple way, find some tool to have in our side to work in the big clinic and the little clinic, in this primary clinic care, and yeah, that's at the beginning.
Yeah. So maybe we should dive in for the concrete stuff, and maybe afterwards we can talk about how this came about. But some of the concrete stuff, what can a normal vet like me do in everyday clinic with this?
Sometimes I hear when I lecture that treating orthopedic stuff is terrible or difficult. And sometimes when you treat osteoarthritis, patients with osteoarthritis, you're not sure what to do, because it's a little bit difficult to see what is the level of the problem that the dog or the cat have. Mm-hmm. And when we started this work, I can say that this is a group of 9 veterinarians from all Europe, and also US, Japan, and Canada. And when we started, it was a very broad-minded discussion, and it was very, very wide. But after a couple of meetings, when we working meetings, we discovered and we decided that this tool should be very, very simple. And just to answer your question, for you, this tool can be working for you when you see the patient, to combine the opinion of the dog owner or the cat owner. What do the dog owner and the cat owner see? How is the dog owner's evaluation of her or his own pet? And then combine it with your evaluation, with orthopedic evaluation, the general clinical evaluation, and so on, and put this together in a form of evaluation sheet. And then you have a grading scale, mm-hmm. that in the end of the course work, you will end up in a simple grade. You have mild or moderate or severe osteoarthritis. It's very, very simple. You don't have to divide it into 10, 20 different levels, because then it's going to be complicated. Mm-hmm. This could be quick, because you must have time to do this in your own clinical half an hour or something like that. Sometimes you can use the owner to fill out the form, or to just think at home, mm-hmm. and start to do it in a paper or digital on some sort of web page, or as we can have a PDF draft or something like that. And then you can put it all together when the patient is in your clinic, and you can examine it and do these other evaluations that is necessary to fill in the form.
Mm-hmm. So it's based on that it should be quick. So I don't have to send the patient off for a CT in order to make this work.
No, absolutely not. This should be simple and quick. It should be accurate, and you must see that you will benefit for it. And that's very, very important. Yeah. But we decided very early in our work that if you do this too complicated, people won't use it because it takes too much time. So quick thing with the owner to have this information as soon as possible and combine it with your own clinic. And then also say that this is a staging tool. This is not a treatment tool. Mm-hmm. The staging tool, because if you would like to treat your patient, you must have the diagnosis first, of course. And if we're just looking at osteoarthritis, you would like to have information on which stage, which severity of osteoarthritis do we look at. Mm-hmm. And then you have to have some criteria to evaluate that and to make up your mind in which severity it is and which type of treatment is suitable for this patient. So this is the first step to have the staging, and the next step, and hopefully we will have possibility to work more in this group, because we have done the more than 50% of the work creating the therapeutic staging work. So probably we will have it in a couple of years.
Yes. Mm-hmm. So it's not completely objective, of course, because we have to ask the owners what they see and maybe what they feel, and we also have to make some considerations in the clinic. Yeah. But it's as I hear it, more a way to objectify a little bit, or to do the same thing every time, so we can look at if the disease is progressing, or we can combine or compare different patients between clinics, maybe.
Yeah, and to see if we have a treatment on a patient, ongoing treatment in a patient, then when we take back it for re-examination, we would like to see, is the treatment working, mm-hmm. or do we have to do any change? Do we have to do any change? Do we have to put in something else, or whatever? Whatever. Just what you say about the objectivity, I think many times in our clinical work we have to do some evaluation that we say that this is a subjective evaluation, of course, but we also know that the information that the dog owner or the cat owner gives us is very, very, very important. Mm-hmm. And it's and also could be very complicated for the dog owner to fill in words what the owner really mean. Mm-hmm. But if the dog owner or cat owner has the possibility to sit in a quiet area in the clinic or already at home, they can fill in this clinical metrology instrument. We use LOAD, Liverpool Osteoarthritis diagnose, and this is a form that a lot of boxes to check in, and then you can have quite a good opinion what the dog owners think that is problem with a dog, and then we start our work to evaluate after that.
Yes. So it will of course make sense if you look at the form that with all the questions on. But can you maybe tell us a little bit about what are the questions generally that we want the owner to answer?
We can divide it into two. One is very broad. It's just said, how do you see? Is the dog in pain? Is the dog in discomfort? And in what level of discomfort? That's a more broad evaluation for the dog owner. And then there are specific questions like, do you see the dog stretching a lot? Do you see the dog to be very stiff after exercise? Do you see the dog be reluctant to jump? And things like that. Very, very specific question to see ordinary everyday things that the dog owner and cat owner perhaps can see and evaluate. And all these boxes to click give some sort of a score together with the more the pain and discomfort area. And then you have a score, and this score is, if you're talking about the load, with this one we are using, and then the load score are transferred to the coast score, and they give us the owner's evaluation of the patient.
What are you thinking about when it comes to some owners will have seen something completely different when they come, even at least to me, and they say, I think it's something with the paw, maybe it's stepped on something, and I find something in the back or maybe in the neck, or I think it has diarrhea and it comes in with the back pain, or sometimes it's completely off what I as a clinician think it is when I see the actual animal. So what is your thinking about how precise the owners can evaluate these things?
Well, what we're looking at is some sort of movement disorder. That's the thing that the owners see. But we also know that movement disorders can arise from very, very many things. That is not orthopedic. I know, I completely agree. But even though it's very important that the owner tells you what do he or she see, and then it's up to us as vet to change it and to arrange it in our mind, in our veterinary mind, to understand what is the owner's owner meaning. I think in a way, even if it's completely wrong, that the owner says something that, for example, the owner tells you that this bitch is limping or movement disorder in the hind leg. And you, of course, your first thought is that it's some sort of a hind leg problem. But we know as a vet that it could be pyometra. And that's just an example. Still, the owner is still telling you the truth, that the dog is limping or the dog has some sort of a disorder in the hind leg. Then it's up to us to evaluate what do the owner means by that.
Yes.
And also very important for us to, in this this flow when we are diagnosing osteoarthritis, to understand the degree of discomfort the dog has, because it's not always the dog shows us what the real problem is, because we are in a different milieu. They are a little bit excited, and the dog can feel that the owner is a little bit afraid or uncomfortable. So you know. So because of that, we like to have the concrete information of how this situation is at home and what the dog owner really sees.
So it's more a thing to let the owner speak freely, so to speak, about the severity of whatever they see, and not making them make a part of the diagnosis itself.
Yeah, absolutely. Yes. Correct, absolutely. We just want to know what do the owners see at home.
Yeah,
that's it. Because then it can give us clues how to proceed. It's not going to affect us when we are doing the different grading, because after the discussion with the dog owner or the cat owner, we try to do the grading of the dog and the grading of the joint, if it's a joint. And then we all combine everything, because the grading of the dog is what we see in the clinical situation. This is movement, the postural changes, the degree of lameness when they're walking back and forth and trotting and so on. It's everything that we can see as a vet. But also the other so-called clinical things that could affect an orthopedic situation or an osteoarthritis situation. And so in a way, this grading of the dog is also in a way subjective, because it's subjective, but we are doing the subjective evaluation. And then we have to do the grading of the joint, and that is a little bit more hands-on. then what we are used to, we have to palpate the joint. We have to make a score what we find in our hands and our fingers. We look at the range of motion, passive range of motion, flexion, extension of the joints, and doing the complete orthopedic examination. And of course, we have to do a general clinical examination too, so we do not forget anything or miss anything. But now I'm talking about the orthopedic examination. And then we, when we are finished that, we do the radiological examination, and we also grade that and score that. Yeah. So we can see the coast system in its simplicity uses 3 different parts. So that's why I put 3 different parts. It is the owner's evaluation with these clinical metrology instruments and this try to describe what they see. Then we have our situation where we're grading the dog as a whole, what we see there, and then we have a little bit more in detail grading the joint. Yeah. And then afterwards, when we summarize everything, we have different types of score, and then we have decided that you have to do this and this and this, and all things is described in this chart. And then you end up with all these scores and ending up with a classification of or staging of the osteoarthritis. Yes. The good thing is that if you combine all these different aspects that you now can put together, you will have a figure. You will have a 1, you will have 2, you will have 3, you will have 4. And then you can start your treatment, and you can also, together with the colleagues in your clinic, in your protocol, note that I have noticed that this has a coast score 2, and if you all use the coast system, you know what your colleague means by that. Yeah. And then you can next time in a month or 2 months, when you are treating this dog with different type of pharmaceuticals or whatever you are doing, you can recheck the dog, and you do exactly the same thing again. And don't forget the owner, because the owner is very important here too, because the owner have to re-evaluate and put up, do I see any changes? Has this changed? Has that changed? And so on. And you do the grading of the dog and grading of the joint again. And perhaps you end up with a score that is, you started with a 3 or you ended up with 2, then you have a progress. You're positive. Yeah. You have succeeded with your treatment. Yeah. Or you end up with a higher score, and then you have to think, okay, my thought was good, but I have to do something more.
But actually, there's a point in that I like to circle back to in a bit. But it's also important. I work in a clinic only a couple of days a week, and quite often some of my colleagues will have a checkup or after examination after 10, 12, 14 days, and maybe on a day I'm not there, and then if they don't do the examination exactly the same, or maybe don't understand completely what I mean, what I wrote in the patient records, and the evaluation might be slightly off and be too subjective, maybe. Yeah. And also, another point is that we usually don't, where I work anyways, don't do all of this in only one setting, because people will, of course, come in with this a bitch with a hind leg lameness, and we will do an examination, and maybe there's nothing, and maybe we'll get some pain medication, and we send it home for like 5 days. But we don't usually start with both weight loss management and change the diet, and start with fish oils, and then pain management, and everything at once. We will take one step at a time. But after the first examination, I could sometimes have a fairly good clue, even maybe just a clue, but a fairly good one to this might be an arthritic patient. And when they come for a checkup, maybe I could start with the questionnaire there, and then start the process there, and then maybe end up in the radiographs. So let's take this patient where it comes back. I've made a thorough clinical examination. I don't think it has a pyometer, and I don't think that it has infected claw or something. I'm fairly certain it has something in one or maybe more joints. What are some of the things? This is of course only audio, so it might be difficult to explain. We have to see some of these things. But what are some of the things that you will feel or you will palpate for in this in the coast system where it's the site that is in your hands?
I think I would like to split your question in two, because it's when we are treating the dog, when we have the first examination and we do the follow-up and we wanted to treat in a good way, we must ask us what is the purpose of the treatment. And it's very obvious, of course, that one of the most important thing is to decrease pain or the discomfort. If we have the dog in pain or in some sort of showing you some sort of symptoms, it's very important that we treat this. And for me, it's very important to, in this case, palpate or investigate or in a way give in a way notice if there is an ongoing inflammation in the joint. As we know, osteoarthritis is a chronic inflammation. So of course we suspect there is inflammation in the joint. But many times when I am lecturing and I'm discussing this problem with our colleagues, I often hear that we don't treat because there's so a little discomfort or there's no pain or so on. But even a very, very low grade inflammation in a joint will develop to a severe inflammation and severe degenerative joint disease. So for me, it's very important that we treat for the day to decrease pain, discomfort. We will have a patient that could live a normal life and an active life, of course. But we must also think that we are treating for the future, because if we can really decrease the development of osteoarthritis changes, then we have done a very good job with that patient, because then this patient will not end up in a severe osteoarthritis. So we are not going to wait until it's very, very bad and then we put in every treatment we have. We have to start the treatment very early, so we do not end up in the severe case. Mm-hmm. And that's a very, very, very important thing to realize. And that's why in this coast system that we have grade 0 to 1. You can, if you look at that in a short way, you can say that looks ridiculous. Why do you have a grade 0? Because grade 0 isn't this dog healthy? Mm-hmm. And it could be a dog that is not lame. But this is the dog that is 6 months old in a breed that is predisposed for growth disturbances. We can think that this dog is in high risk and so on. And to identify this relatively young dog at high risk system could be very, very useful, because this dog is prone to be a severe osteoarthritis dog in 2 years, 3 years, 4 years. And then we have a lot of problem, and the dog has a lot of problem, and the owner has a lot of problem. Could we, in some way, surgically or medically, remove this risk? Mm-hmm. Then we can save this patient for the future. So that's why we have this low grade scoring 2, 0 to 1. More call it like a risk for being in the bad situation later. And then when we came up to 1 or 2, 3, 4, then we have detectable osteoarthritis changes with osteophytes and degeneration and so on.
Yeah, and that's sometimes also a challenge for some. I'm more interested in orthopedic diseases and arthritis, so I think I might find a little more than some of my skin colleagues does, and the other way around, of course. I will miss some of the skin diseases more often than the other way around. So can you maybe help us a little bit to what to look for when the dog is in the clinic? Maybe some of the more vague signs that we can find, but the owner maybe not have thought of anything of.
Yeah, when the dog is really lame, then it's no problem for the owner to see it, because then they see us, then they can see it and we can see it. I think for us to look at in the clinic, when we have a owner that just telling us that I do not recognize my dog. The dog is not acting as normal at home. Or many times they say that the dog is not only not so much active and sleeping a lot and will not like to play and things like that. And in my clinical situation, receiving that dog and discussing this with the owner, I look very, very carefully at the dog. First, when I am sitting just discussing it with the owner, I'll leave the dog on the floor, and the dog can move around and do whatever it like. And normally, a dog that is sound and healthy will examine the room. Mm-hmm. If the dog just stay or sit or go and lay down, that's not normal. And then after that, starting with the evaluation to see the movement, see the dog walking back and forth, see the dog trotting back and forth, and try to evaluate what's the difference, what's it happening, why is it not balanced, and so on. And this is actually why I'm in Denmark today, because tomorrow I will have this movement course in Jylland. So that's very important that we, with our eyes, can see that, okay, this is not normal. This is some sort of disturbance in the movement. And then after that, of course, I will do a normal clinical, general clinical examination. But in the orthopedic examination, I'd be very accurate to palpate every part of the dog, even if you have just half an hour or 45 minutes in booked on that patient. You can't skip anything. You have to palpate every joint that you can reach, from the toe to the lumbar area or to the thoracic area. Because if you do not do that, you will for sure miss something. Because it's like this, that a dog can have two problems. We know that. Yeah. So if you find one, you don't have to miss the second one, because you have to find that too also. And be very accurate with your palpation. And my absolutely strongest advice to all my colleagues working with and have interest in orthopedic examination and orthopedic evaluations is to train your fingers. Because you can buy a CT scan, you can buy MRI, you can buy ultrasound, you can buy a lot of very, very expensive equipment. And that's, of course, could be very, very helpful for you. But you can never do anything nearby what you can do with your own fingers. Because if you train your fingers and do it all the time, and then you can very, very quick realize when you're palpating this dog that is you have in your clinic, okay, this joint is not feeling normal. Here we have something wrong, and then you have to decide: is this pathological, or is this in some normal appearance for that dog in that age or something like that? You have to have a discussion with yourself too. But that's just experience. But just the way to train to have a feeling in your fingers that what is normal and what is not normal. Because the only thing that can make us understand and detect abnormal thing is to know what is normal.
Mm-hmm. Yes, and like training when I first started to feel lymph nodes and to look the patient in the eye and listening to the heart, I had no idea what was normal. But if you haven't stretched or flexed an elbow joint or the toes, you wouldn't necessarily feel what's normal or not. And even though you might not remember to do all the exercises, you will still get something from it, even though it's just a regular checkup and just to maybe play with it or just be curious to do it instead of thinking about this orthopedic examination is very complicated and I have to do it right, and if I don't find anything, I'm a bad vet. And this is pretty much what I think about the skin diseases, because I don't remember all the steps we have to go through. Not before I made the course on the website anyway, but maybe just doing a couple of things to train the feeling is what's normal is that's my point anyway.
Yeah, absolutely, and also have a routine that you build up for yourself. When you're working with orthopedic examination, do the same thing all the time. Start there and end there, and don't skip anything. Don't because even if something could be very, very obvious when you see the dog for the first time, don't skip the examination. You have to do the same routine. Even though me and my colleagues that are lecturing in this lameness and this lameness course that they were doing in Norway and Sweden and Denmark, even though we have been working with the orthopedic examination for almost 40 years, we still, after all these years, do exactly the same. We start here, we end up there, and we don't do anything that will give us some reason that we will miss anything. And that's the thing that we try to educate and to learn our young colleagues to really think of.
Yes.
Your own routine.
That might be a tangent, but I've been lucky enough to be on one of your courses, and I've when I was a young vet and when I was a vet student, I had I was lucky enough to spend some time with Klaus Slot and Ken Lindblad, and I know you know. And sometimes I would have this frustrating orthopedic patient that I will refer to them, and I will go with it and to see what they did and try to figure out what magic or sorcery they could do. And every single time it was just basic, thorough examination. Yeah. And what they did that I didn't was skip anything. So they and if they didn't find anything they were sure of, they would just make the whole thing once more.
Absolutely.
And it wasn't magic, of course. It was just and of course there was some because they have at that time they had 30 years worth of knowledge. They will of course find something with the fingers that I wouldn't, but it was still doing the exact same examination as everybody else, actually.
And one thing more that is very important, we're talking about knowledge, we're talking about experience, so that's of course very, very important. But also, something that's very, very important, you have to know your anatomy.
Yeah.
It's a long time since we went to vet school, and the first year we were struggling with anatomy and have to learn all those muscles and skeleton parts and everything. But this is still as important as it was then. We really have to know whatever. We don't have to know all names, of course. That's not so important. But we have to know what this muscle begins and ends and the function, and also how the body works and all those different things. And also if we are connecting to this osteoarthritis discussion, we have to realize and understand what is happening in a joint or in a part of the body that is under attack, under inflammation. So if you have a joint that is inflammatory joint that is developing the degenerative joint disease, it's very important that you understand what is happening. And actually this is quite complicated because you have a lot of mediators and you have a lot of different types of things that's happening simultaneously, leading to the dead end at the end. And if you are going to convince an owner that the owner have to do that and that and that to help his or her dog, you really have to know it yourself. You have to know what you're talking about self. Otherwise you can't explain in a simple way for the owner. And you have to convince the owner by explaining. Because if you don't have an owner that understands what the dog's problem is, then the dog owner won't do what you say that he or she is going to do.
Yeah. And maybe that's actually a segue into my next question, because sometimes it can be challenging to convince the owner to the X-rays, and that was a third pillar in this COAST system. So I'd like to talk a little bit about that before we end up here. How useful is this if the owner doesn't agree at all to X-rays, or one of the formulations is usually that no, he's just an old boy and he should just we should leave him be until he dies a peaceful death by himself. Some morning he doesn't wake up, right? And usually you don't die from osteoarthritis that way, anyways. But and sometimes we can, by explaining, we can actually come to agreement on what's best for the dog, because of course X-rays are not always the solution. But how useful is this COAST system if with or without X-rays?
I think it's very useful. I think you can show the owner if after that moment that they have filled in the clinical metrology instruments and give them their evaluation of what's happening with a dog, and you do your part or the veterinary stuff, then you can really sit down with the dog owner and just point at the chart, of the COAST chart, and see, okay, you see here we have, this is what you say. This is if you were honest in your answers. This is what we end up in discussing with what you have seen. And here is my opinion. This is my evaluation. This is my clinical examination. And you can see we have this problem, because then you have something to look at. You can see something that you're looking at, something that the dog owner can understand, because this is figures. If you say that 3 is worse than 2, I think they understand that. And if you see that you have a 2, and next time you see the dog, you can evaluate to 1, then you really say good to the owner. You have done a terrific good job. You see, now we have decreased the problem here. So I think it's very important that you show the owner this COAST chart and you discuss this together and look at the different types. And this could also motivate to do further examinations. For example, radiology, or if you want to go even further, you do a CT scan or something like that, because you see that we know, perhaps you say to the dog owner, you see here, we have a problem here, but we are not completely sure, because it could be something more. For example, we have this 8-month-old dog that is limping and we suspect a growth disturbance. Okay, we can't see anything X-ray. That's not so unusual. Mm-hmm. We don't see anything in X-ray, but you see by yourself. You have score here that the dog has this cough. It's lame at home and it's stiff and it's will not like to play and so on. And after a walk and an activity, you see the lameness increase. Okay, you see that, but we can't really see that what it really is. So it's very motivated to do the CT scan to get a little bit further to see if we can stop this now. So you recognize the discussion, just to convince the dog owner that the way you want to treat this patient in the best way. Yeah. Because it's always a discussion. You have to be in. This is a teamwork. This is a teamwork between you and your staff and the dog owner. Yeah. I say dog owner most of the time because this tool is most applicable for dogs, of course. Yes. Yeah. And I will also say in this way that I would like, and I also say to all the clinics that we were lecturing and that we were discussing this course that take this as a team thing. And I say the team with the owner, of course, but also the team in the clinic, because you as a vet, you don't have to be in charge of the meteorology instrument or the owner. You're a good nurse, a nurse that is trained in this, can sit down with the owner and discuss this thing and come up with this evaluation. And many things we can be as a team. You and your nurses can work together to do this in a good way. Yeah.
I usually end up by, at least at one point, pulling the conversation in a bit more philosophical or political direction. And you have to excuse me because I'm going to do that now as well. But sometimes I feel like if the owner is hesitant to agree to X-rays, it's because I haven't explained good enough why they are important and why we should use them. So if I'm a bit uncertain what's up with this dog, maybe there's something there and maybe there's something in the other end, and maybe we should just do some blood work and do a bunch of X-rays to see if we can find anything. It's more stabbing in the dark, right? Instead of going for the diagnosis and be confident that my recommendation for X-rays is the right thing to do. And this is one of the things I like about this system, is that you have to take time to listen to the owner and be fairly concrete about it. And you have to, and you write down what you actually find and what you don't find. And you can point to the questionnaire and point to the form, this is what we are going for. And when I do that with blood samples and X-rays and CT scans and whatever, I feel like, I don't have any data on this, but I feel like the owners are way more likely to agree to go ahead and get the diagnosis confirmed, because they can see the benefit in doing so, instead of just making me feel better or making me more sure that my insecurities are covered. But that wasn't really a question. That was just a political point that I usually have to get out.
Yeah. It's a little bit of philosophical discussion. That's good. I think you said something that I must comment, because you said sometimes you can be in a situation that you can't find anything, so you take a bunch of X-rays. Okay, in my way of seeing it, I think it's very, very important that when you use different types of diagnostic modalities, whatever, you have X-ray, CT scan, whatever, MRI, so you always have a question. I read CT scans, help my colleagues reading CT scans, and the worst cases I can have is someone that in the protocol writes, I can't find anything, so I do a CT scan. Mm-hmm. You have recognized it.
Yes.
Yeah. And for me, it's very important that you have to find something. So you have to find some sort of change, many changes. And then your question is this pathological or it is normal? And then you go to the X-ray or to the CT or so on. And also, if you examine a patient, you see the patient is lame, but you can't even after 2 hours examination you can still find which leg or which joint or which part or so on. I think in this case you have to just perhaps say that for the moment I can't find the source. I can't find the clue. What is this? Could you please come back next week and we do it all again and we try once more. And or if you want to, in my earlier work when I was working in a very big hospital or in the faculty, then you have to. Okay, I would like to have a discussion with my colleague, and that's very good because a dog owner is always feels very secure if a vet says, okay, I'm not quite sure, but I will talk to one of my older colleagues to see what he or she thinks, and have a discussion about just my dog, and that's convincing that this clinic or this hospital is doing whatever they can to solve the problem.
Yeah. So you would rather advise me to do that instead of doing just a bunch of X-rays?
Yeah, absolutely, because you will end up in a bunch of X-rays that you will certainly find something. If you have a middle-aged dog and an X-ray every joint in the body, I'm 100% sure that you will find different parts of changes that could be eventually be some problem, but you still don't know. And this is actually a problem when you transfer X-rays or CT scans to very competent radiologists. It's very in Sweden. It's very common that you have, for example, both X-rays but also CT scans that is read and evaluated by radiologists in some other place. And then you have you have a lot of writing in this answer, because the radiologist always writes everything that this radiologist sees, and that's quite a lot. But because they're very skilled, and then it's up to us as an orthopedic clinician and an orthopedic surgeon that going to make up. Is this something that we have to address? Is this a pathological problem that we have to do anything about? Should this be treated? Should this undergo surgery, or what? And so, back to basic again, because even if you do those modalities, CT, X-ray, so on, you are still back to this basic decision. Is this thing that we see here, is this what you are going to address surgically or pharmacologically? And I must also in this say concerning the medical treatment that because you said a little bit earlier that in the first time you see a dog, you examine the dog, you don't always put in everything at once. And I completely agree with that, because when you have your evaluation, you have your grading, you have perhaps your coast grading, low or high, then you go in, you are going to look at your so-called portfolio, what do you have? And then try to see, okay, this is some sort of a pain ladder, and this pain ladder is in very low degree. You try to that one, and then you can do, as you know, we try to have many types of pain management, and also anti-inflammatory medications and so on. And then you add and you add and you add, and then you have to re-evaluate and then add something else just to see if you can reach that point that the dog is comfortable. And multimodality in the pain management is very, very important to understand that, and to understand and to do the multimodal pain management and osteoarthritis treatment, you also have to understand what's happening inside the joint. So you're treating exactly the right spot, and then try to stop what's happening, what has happened before the dog reach your clinic. You can't do anything about that. But what's happening afterwards, when the dog is your patient, then you can do quite a lot by treating it in a right way, a normal way.
And that is, of course, what the COAST system aims to do. And to circle back to the last point, it sounds like we can use the COAST system even though the owner doesn't agree to X-rays, or even though I don't have an X-ray machine. I have where I work, but if you don't have an X-ray machine, you can still get some benefit and get some evaluation from this COAST system, even though the last pillar in the system might not be there.
Absolutely, and that's very important. That's a very important point you're doing here. Because one of the bottom line things that we were thinking of when we were creating the COAST was that this is not going to be a university thing or the big hospital thing, because then it will not be successful. This will be the one vet clinic, perhaps a very small clinic, the primary line where the dog owner and the dog come, the local vet, whatever you call it. So this will the primary care should be where the COAST starts, and then, of course, depending on what the result is, or if the dog is transferred to referred to another clinic, then the COAST will continue there. But it's aimed to be very, very useful in the little small clinic where you don't have so many equipment.
Yeah,
absolutely.
Yeah,
that's important.
I'd like to end with maybe a rapid fire round with some random cases, and maybe we should just focus on if the COAST system is applicable or not. Not making a lot of diagnosis in these cases, but maybe if this can be used or not. So we already had this pyometer coming in with a lameness, and maybe that's found in the clinical examination. So that's one is crossed off. So another case could be a German Shepherd dog, like let's say 1.5, 2 years old, maybe not visibly lame, but the owner is concerned of HD in the hip joints, of course, because they have talked about it in a Facebook group or maybe in the training grounds, and then they come for a checkup and they ask, "Can I be sure?" Maybe without radiographs, if my dog has HD or not, or is maybe in higher risk. Is my specific dog in high risk for HD? Can I use the COAST system for that?
Yeah, absolutely you can, because in this case you have the anamnestic information from a dog owner will point in this direction. We have the classical reluctant to jump and so on. So we have this anamnestic information. And then when you're doing the clinic and we're grading the dog and grading the joint, of course we know that it's quite difficult to palpate the hip joint because of the muscle around, but you still can do some tests. You can, the hip dysplasia is hip replasia is just a word. Dysplasia in this means more than you have a laxity in the joint. So this laxity could be the first notable symptom, and this laxity and this instability in the joint will lead to degenerative joint disease. And this laxity you can test. You can do the Ortolani test. You can do the balance test. Okay, you have to sedate the dog, but that's possible to do even in a very, very small clinic. And even if you don't have any X-ray, you can. If you do a good clinical examination, you can still be quite sure that this dog has a laxity or this dog has not a laxity. And then you can do the passive range of motion in the dog awake and also under sedation, and you can evaluate the range of motion and see if there's any problem. So I will say that even if you do not do an X-ray, I think you can almost up to 90% be sure that this has or this dog has not this problem.
Yeah. The next case is a referral case that we got actually last week. It's a 14-year-old Westie Highland White Terrier. And it was referred with suspicion of a cruciate ligament rupture. And even before the dog came to the clinic, we were talking about it in-house. This is a 14-year-old dog with all sorts of genetic difficulties, right? It's not a dog that we've seen before in our clinic, so we didn't at that time had any history on it. But when I saw it, it was actually a quite nice dog. And I did a thorough, in my hands anyway, orthopedic examination, and I couldn't find anything. Not in the stifle. Except for the stifle. And it had a very the jaw movement was quite obvious, and we did X-rays and found, and we sedated the dog, of course, and took X-rays, and it had a cranial cruciate ligament rupture, but I couldn't find anything else. There was, of course, a little bit in the hips on the X-rays, but the physical examination didn't show anything, and the history on the dog didn't show anything, and the teeth were also quite good, and it didn't have any history of skin diseases. So we had a discussion: is this actually a good patient to do surgery on? It's 14 years old, and maybe that's not a good case to just from the age it has. But on the other side, it was a fairly sound dog in my hands anyway. So could I have used the COAST system here to be more certain if this was a good surgery patient or not?
Yeah, I'm quite sure of that, because I think the evaluation that the dog owner supply you with would be quite positive, because if you have a dog that is 14 years old and been sound probably most of his life, or her life, and have the cruciate ligament rupture, then if you have the cruciate ligament rupture, I suppose the dog is still quite active, because you don't. Okay, they could fall down from the sofa, but because they have the cruciate, this is a.
They were playing in the garden.
Yeah,
so it was quite active.
Yeah. And then the dog, the owner, will give you all that information, so you will end up with quite a positive opinion about the dog in this metrology instrument, and the owner's own in the dog owner's own words, and so. And then you, as you said, you were doing the grading the dog, grading the joints, and except for the stifle joint, you didn't find anything. Then you will end up in quite a low grade, and you don't find any osteoarthritis. If this stifle injury is quite acute, you don't have any osteoarthritis sign here. You have a pain, you have a draw motion, but you don't have any other signs of disease. So you will have a low grade, and together with your own conviction that it's not a disease to be old, so then you can just say that, okay, do surgery, absolutely. We are treating the whole dog, not only the joint. So we are not not treating just the joint, we're treating the whole dog. If you have a dog that is sound, active, even if it's 14 years old, absolutely go for it. The oldest dog I have ever done surgery on, was Japanese Spitz, and it was 21.
Yeah, okay. And that was what we ended up doing, and we did some version. We didn't use the COAST here. I'm sorry to say, but we did some subjective version of evaluating the dog. So but it could have been nice to have a measurement score to
just see the figures.
Yeah, just to see the figures and to feel more confident. So the last one is also a fairly old dog, 8 years. It's owned by an elderly lady. So walks are fairly slow. They don't. She doesn't do too much nose work, and she doesn't do long walks. And the walk she does is fairly slow. So the dog is heavy. It's quite obese.
Overweight.
It's very overweight, yes. It might also have signs of hypothyroidism. It might just be eating too many cookies. I don't know. It has fairly bad teeth as well. So and it hadn't been doing dental work on it for some time. So there might not be a bad tooth somewhere. And the dog is just slow. Seems happy enough, but it just seems slow. And it's definitely not jumping anywhere. But it can be from a wide variety of things. And of course, in the ideal world, we have to do a lot of workup on this dog. But is the coast system, does it fit in here at some point?
Yeah, I think so, because as in the previous case, you probably have quite a good opinion from the dog owner, because this elderly lady, perhaps this dog is her one and only companion, and they have a good life together, and the life they are doing together are slow but convenient for both of them. Then your examination will perhaps reveal some sort of changes in some joint, because if this dog is overweighted, we could have a have a risk of osteoarthritis, of course, in different joints. So I will say that you will probably, if you find those joints, you will end up in some sort of mild or moderate. I should suspect that in that case, in a case like that. And then I will not have any question about doing a protocol, how the treatment protocol. That should, of course, include to reduce weight, of course. And we know that just convincing the dog owner that reducing weight will benefit the dog, it will be more happy, and just to really think about those things, and also put this dog on a suitable medication, and then you will have a dog that could be really happy again. Perhaps not moving too fast anyhow, because it won't get faster than the lady, but they could have a happy life together. Because what are we doing as clinicians? Well, our main goal is to take care of the pets, and take care of the pets so they are not suffering. We have to make attention of the law, of course, and the dogs and the cats should not suffer or in an improper way. That is obvious. But on the other hand, as I said previously, it's not a disease to be old. It's another way of living. What are the owner's expectations? That's very important, because if this hunter have a very good dog that has a cruciate ligament injuries and with a meniscal injury, then it will take quite a long time to get back to normal work, because the expectations from this dog owner concerning this dog is very, very high. And then we, as a vet, must have this discussion with the dog owner, so we are on the same level. The old lady you are talking about have complete different expectations. Her expectation is that this dog can live together with her, and they can have a nice, slow life together. And in this case, if we can't see that this is any in a proper way of handling, of course. But if we can see this, we can help this dog to a pain-free, normal, good life, a little bit slimmer, perhaps a little bit less weight, but in a good way. And the dog owner will be happy, and the dog will be happy.
Good. I think we should leave it there. I could talk for another hour on this topic, but we shouldn't. I would very much advise people, if they, or the listeners, if they see your name on any talks or any courses, they should go for it, because you're a very good teacher as well, both here in the podcast, of course, but also in the physical courses. But if people would like to know more about you, or maybe follow you and keep an eye out for what you're doing, is there anywhere people should look especially?
Well, we have my company, and we have a web page that is called Herrgårdskliniken.se, Herrgårdskliniken.se. And on that web page, we have the information where I am lecturing and how my schedule is. So you're very welcome to look at that. Absolutely.
Thank you very much, Ole.
Thank you. Thank you. Nice to be here.
Husk, at du kan finde links og noter til dagens afsnit på SIVP.dk, og så episodens nummer, for eksempel SIVP.dk/1. Og føler du et behov for at udvide dine faglige færdigheder, uden at skulle tage en hel dag væk fra familien og fra klinikken, så har jeg nogle online kurser til dig. Du har måske hørt mig sige det før, men du kan få en hel måneds gratis adgang. Og det kan du få med en speciel kode, som jeg ikke deler noget andet sted end her i podcasten. Og det er fordi, at dig, der lytter til podcast, du er noget helt særligt. På SIVP.dk/XYZ får du 4 ugers gratis adgang til kurserne og protokollerne på hjemmesiden. Alle kurserne har specifikke læringsmål, så du ved præcist, hvad du får ud af den tid, du investerer i det. Du kan for eksempel lære at lave en regelret neurologisk undersøgelse og bruge det allerede næste gang, du er på klinikken. Du kan også lære at tolke blodprøver, og du kan lære at lave et godt finlåsaspirat og tolke det sikkert. Der er meget mere, men kig over på SIVP.dk/XYZ og tilmeld dig den gratis adgang, så kan du se, hvad du kan lære og bruge allerede næste gang, du er på klinikken. Udover alt det, så får du også adgang til et lukket online forum, hvor du trygt og sikkert kan dele alle dine i gåseøjne dumme spørgsmål. Dem er der selvfølgelig ikke nogen af. Men vi er sammen om at lære. Du skal ikke lære alene. Vi er sammen om at blive bedre. Og så ved jeg godt, at der er nogen, der er bekymret for at tilmelde sig et medlemskab. De er måske bange for ikke at få det brugt. Og jeg ved godt, at du som lytter til det her, jo går op i din faglige udvikling, for ellers havde du jo ikke lyttet til podcast. Men skulle du nu alligevel være bekymret for at glemme at melde dig fra, når din gratis måned udløber, så skriv lige til mig. Jeg har nemlig resultatgaranti, og det betyder, at hvis ikke du ser resultater i din hverdag, så skal du selvfølgelig ikke betale for noget for at have været på kursus hos mig. Se på SIVP.dk/XYZ for at tilmelde dig en gratis måned med det samme. Vi ses!